The whole idea of CER is to let people know what different drug interactions are, which drugs work better than others, which are cheaper. And President Obama had that famous thing where he talked about the red pill and the blue pill, and if you knew one was just as effective and one was cheap and cheaper, wouldn't you want to have the cheaper one? And first of all, it's not that simple. But second of all, the asymmetry is that the idea is that other people can talk about it, meaning researchers can talk about it, and universities can talk about it, government can talk about it, but pharmaceutical companies are constrained in the way they can talk about their product, and that creates a problematic asymmetry from my perspective. The FDA just has a different view of free speech than, let's say, your average American. I mean, people think you can talk about anything because it's a free country, but the FDA has said numerous times that they think that there's a public health interest in constraining free speech at times. And so they think that there's a greater good in constraining free speech. That means the pharmaceutical companies have to be very careful what they say in marketing, in advertising, in social media. And so because they kind of have that constraint, the hands tied behind their back, there's going to be all this new research coming out, and pharmaceutical companies may be limited in what they can say about those things. In some ways, the public health may be harmed if people can't get the accurate information. Now, perhaps the FDA might want to play a neutral or umpire role in that perspective and get accurate information out, but it would be a deviation and not exactly something that FDA typically does. From the pharmaceutical company's perspective, they say, well, FDA doesn't publish guidelines because they don't want to be limited by anything that gives the pharmaceutical companies a clear lane to act. The FDA says, well, if the second we publish guidelines, the pharmaceutical companies find ways to circumvent them. So those are some of the reasons. There are other reasons in terms of bureaucratic inertia that make it hard for them to put out guidelines. But the lack of clear guidelines is consistently a problem.